Hello, Coach JPMD here. So we're back. We're back to releasing episodes every Monday. So expect to see an episode drop in your podcast app every Monday and hopefully every Thursday coming soon. Took a little break over the past couple of months. And we also rebranded our podcast last year to the Independent Physician's Blueprint. So stay tuned for new episodes releasing every Monday morning. Welcome back to another episode where I help younger physicians decrease stress and increase income by transitioning from corporate to independent practices, even without any business experience. Welcome to another episode of the Independent Physician's Blueprint with your host, Coach JPMD. And so we're back. We're back on schedule with an episode on Singapore. As I told you last week, we're going to continue this longevity series, looking at the top 10 countries in the world that live longer and do things differently. Number 10 was Reunion. Spain was number 9, and Singapore is number 8. And where is Singapore? Well, if you look at the map, and I kind of had to be reminded because I thought it was near China, but it is not near China. Singapore is in Southeast Asia, just south of Malaysia. It's an island off the coast of the southern part of Malaysia. And on the other side, on the western side, is Indonesia. And it's a tiny country with a population of about 5.86 million people. And their life expectancy is 84 years. And women live 86.48 years on average, with men living 81.5, which is the common theme amongst life expectancies in the world. Women live longer than men. And so what are some of the characteristics of Singapore? I found a website that kind of describes some of the contributing factors to the longevity. And I also realized recently that Singapore made it to the blue zones. They're now I believe the 6th country in the blue zones. If you heard my episode on the blue zones, you'll know that there were 5, now there are 6. And some of the factors that are contributing to the longevity from this website, I found Santorium.health. They talk about Singapore and their healthcare system. So their healthcare system is world class. They have highly accessible healthcare. And so if you look at the hospital statistics in Singapore compared to the United States, there's about 2.6 hospital beds per 1,000 inhabitants in Singapore versus 2.74 hospitals per 1,000 in the U.S. It looks like the United States has more physicians per 1,000 inhabitants. And so those are interesting statistics. We also know that there's a really big push for healthcare promotion initiatives, or there's a healthcare promotion initiatives that are very heavily promoted by the government in Singapore. Your family-oriented policies like tax breaks for young families living near aging parents. There's urban green spaces projects. So there's a lot of things that the government is doing to actually promote health. And that is something that I think can be done with a smaller population. And at the end of the series, I'm going to basically give you my thoughts on why these countries are living longer than the U.S. Obviously, we have 340 million people in the U.S. versus Singapore's 5 million. So I think there can be something said about how the government can control their populations, or at least promote different things in their populations a little bit better than a larger country, especially given that the last 3 countries, Reunion and Spain, have a much lower population than the U.S. So that is Singapore and some of the characteristics of Singapore. A couple other things that I found was the lifestyle factors contributing to longevity. And the fact that there's good social connections. There's a lot of emphasis on family and balancing lifestyles as well. And so this is something that I think other countries can learn from. There also is a focus on prevention. and slowing down diseases like dementia, diabetes, and heart disease. So in terms of causes of death and mortality in Singapore, I found a resource actually from the Singaporean, I hope that's right, Singaporean government that states that cancers lead the top principal causes of death, followed by pneumonia and ischemic heart disease, cerebrovascular disease, strokes, and hypertensive diseases. So those are those sound similar to other countries. So Singapore is in the Southeast Asia. It borders Malaysia, and that didn't hit, I don't believe, the top 10 countries in the world in terms of life expectancy. So it's not necessarily that you're living in Southeast Asia and you're living longer. They must be doing something different. I didn't go over their religious practices. So the most followed religion in Singapore is Buddhism, and it's followed by people with no religious affiliation. Christianity comes in, I think, about third, and Islam is about 15% at fourth. So I think the predominant religion is Buddhism, and the predominant people that occupy Singapore are the Chinese. So that's the episode on Singapore. Next week, we're going to talk about Italy. Italy is a country that ranks in the top 10. So we'll hear some statistics and characteristics of Italy and how it compares to the United States. And I hope you're enjoying this series. I think it's enlightening for me to understand what other countries are doing, and it helps us understand as physicians what we could potentially do and what we can emulate in our country in terms of our population of patients that we're taking care of, and also in public policy. And it seems like public policy seems to be driving a lot of the longevity that we're seeing in countries that are a little bit smaller than we are. So maybe that means that we should be taking things up in our own communities to help our populations live long. So we'll see you next week when we talk about Italy. Thank you so much for listening to the podcast. If you'd like to hear more, subscribe, follow in your favorite podcast app so you'll never miss an episode.